Hello and welcome to the Paris Peace Forum. Welcome to this panel, Preventing the Worst, Protecting and Supporting Vulnerable Populations During Pandemics. Thank you so much for being with us. Thank you for tuning in as well. It's really wonderful to have you here. I have four fantastic high caliber guests with me. My name is Claire PACCALIN and I'm a reporter at France 24, that's the French news channel and website. So thank you everyone for joining me today. I'm going to start by introducing you all. Let's start with Peter MAURER. You are the president of the International Committee of the Red Cross. Thank you so much for being with us.
Thank you. Thanks a lot for having me.
We're delighted to have you here, Mr. Maurer. I also want to introduce Ingrid Gabriella Hoven. You are the Managing Director of the GIZ. Now that's Development Implementing Agency. So you implement development projects for the German government, but not only. So thank you very much for being with us today too.
Thank you for having me, and best regards from Frankfurt.
Thank you very much. David MILIBAND, thank you very much for joining us. You are the President and CEO of the International Rescue Committee based in New York. Thank you so much for being with us.
Very nice to be with you. Nice to be with our GIZ partners who we're proud to work with. And of course, happy to be here with Peter MAURER.
Brilliant. I'd also like to introduce Nadia Murad. Now, Nadia is a Nobel Peace Prize laureate. Her life was brutally interrupted in 2014 when the Islamic State group attacked her homeland of Sinjar in Iraq. Nadia Murad, thank you so much for being with us. You are now running Nadia's initiative and you speak up for vulnerable communities around the world. And I understand that you're going to start this session with some words you have prepared for us. Thank you. And well, the floor or the screen is yours. So go ahead, Nadia Murad.
Thank you so much. Can you hear me?
I can hear you fine.
Okay.
Can you hear me?
Yes.
Good.
So thank you so much. I would like to thank the Paris Peace Forum for inviting me to participate in today's discussion. As a member of French Gender Advisory Council, I am grateful and inspired by the French people's commitment to gender equality and their leadership in pursuing international legislation that promotes and protects women's rights. The COVID-19 pandemic has reversed the world's progress toward our global development goals. It has strained healthcare systems, threatened livelihoods, created conditions for mass hunger, and enabled increased human trafficking and sexual violence. On all of these counts, women are most severely impacted. They are first to lose their jobs, to attend to childcare, first to sacrifice their meal or medicine, and first to be abused when domestic relationships are destabilized. What is clear is this: the pandemic has not affected all people equally. Displaced communities and those living in poverty are suffering disproportionately. As we speak, over 79 million people remain displaced globally, including 26 million refugees and over 45 million IDPs. Their only safety net is the generosity of the international community. But the global impact of the COVID pandemic is straining this system. When nations turn inwards to face crisis at home, that international safety net for the most vulnerable can easily dissipate. The COVID pandemic has exposed the deficiencies of our international refugee system and the precarity of those whose lives hang in the balance. It has become more apparent than ever that humanitarian relief for displacement is often inadequate and unsustainable. Displacement and sexual violence are on the rise, while access to basic resources has diminished. My organization, working on the ground in Sinjar, Nadia's initiative, has seen COVID magnify the problems faced by my community. We are witnessing a decrease in international will to support the recovery of Yazidis. The momentum to hold international trials of ISIS criminals is slowing, while the challenges of rehabilitation are growing. How can Yazidis fight the spread of this virus when ISIS destroyed their hospitals and water and sanitation services? How can Yazidi children utilize remote learning when ISIS destroyed their schools? For 6 years, hundreds of thousands of Yazidi survivors of genocide and sexual violence have lived in IDP camps, where an entire generation is growing up without adequate education or job opportunities. We cannot create a sustainable world if we keep entire communities in unsustainable living conditions. I believe that the best way to sustain marginalized communities is to empower them. Today, we are discussing how to integrate gender, cultural, and geopolitical specificities into development practices. All too often, we do not include affected communities in these conversations. We cannot effectively stop the spread of this virus until we protect the most vulnerable. Community health is only as stable as the community's least healthy member. If the disease exists anywhere, it can spread everywhere. Unfortunately, displaced, rural, and impoverished communities are often left behind during public health crises. The entire world will continue to suffer from this pandemic until sufficient support is provided to under-resourced regions like Sinjar, Iraq. Communities like the Yazidis cannot start building a better future without tangible support. Providing vulnerable communities, particularly women, with the tools to combat a health crisis improves their ability to manage the spread of disease in their region and across the world. In the globalized 21st century, people are more interconnected than ever. We are one community. When we approach development and global health with this inclusive lens, it is evident that investing in those most vulnerable will benefit society as a whole. This is a turning point for the international community. Nations must decide whether they will compete over national interests or hold each other accountable to our shared goals and values. They must decide whether to proactively mediate peace in emerging conflicts or wait until hundreds of thousands of refugees are on their doorstep. They must decide whether to construct tents in temporary displacement camps or empower communities to rebuild their homelands. It is my hope that this pandemic will teach us to go forward with empathy, inclusiveness, and justice as we work together to combat the spread of COVID-19 and restore communities in crisis. Thank you so much for listening and having me.
Thank you so much, Nadia MAURER. That was very thought-provoking. Really enjoyed your contribution. I understand, though, that you can't stay and that you have to leave us now. So thank you for your thoughts. Take care and hope to see you again soon.
Thank you so much.
Well, I would like to turn now to our three remaining panelists. For the next half hour, or perhaps more like 40 minutes, we'll be discussing how to support vulnerable communities in pandemics. We'll be looking at some of the lessons learned, as well as taking a look at some global and local solutions. So I'd like to start with you, Peter MAURER. I would like to know, we're in the middle of a public health crisis, clearly, but what lessons were learned from previous epidemics and pandemics, and were they helpful in addressing the COVID-19 pandemic that we're going through right now?
There are a couple of lessons learned from previous pandemics and a couple of lessons learned from this pandemic as it lasts already a couple of months. I would start with the recognition that while we are in a public health crisis because of the pandemic, none of the other big challenges with which we have been dealing with over the last couple of decades have gone away. Neither the underdevelopment, neither climate change, neither conflict and violence. Rather, the pandemic has accentuated and accelerated some of the problems and compounded some of the problems with which we are confronted. I think there are a couple of lessons learned which are important. First, we have seen in previous pandemics, and even more true today, that just focusing on the pandemic and not keeping a perspective on the overall health system delivery is really the thing not to do. It is important that we keep this systemic approach in view. If we focus exclusively on the pandemic, the result will be that mortality is rising on other issues which are important health challenges and which will be neglected. A second thing which Nadia alluded to is at the end of the day that we can only be successful if we invest in vulnerable communities and if we have the trust of vulnerable communities. The trust of vulnerable communities comes from proximity and engagement with these communities where they live and having an ability to read and to engage on what the priority needs are. We can't fight the pandemics with a technocratic reading on what should be done if we don't consult communities. The third issue I wanted to highlight as lessons learned from previous pandemics is that any pandemic and health crisis is a door opener most of the time for serious protection issues. Here again, Nadia has alluded to it, what we are talking about. We have increasingly vulnerable communities which do not just need services, but they need to be protected. Hospitals and health workers have been attacked more frequently over the last couple of months than even before. And even before we had a huge problem. We have seen numbers of violence against health workers spiking. And this again is just one illustration what we are talking about when we talk about protection crisis. We have vulnerable populations, displaced populations, victims of sexual violence, victims of war, and I think these are all communities which need to be protected, while at the end of the day, pandemics always open the door for stigmatization, misuse of power, wrong arguments for restrictive regimes, and more that we have seen. The fourth lesson is really to keep an eye on what the pandemic does to justice. And I think we have seen over the last couple of months that the gap between those, the haves and have-nots, the vulnerable and those who are striving on the pandemic has increased, and the gap has been compounded by the imminent financial and budget crisis in many donor countries, and therefore the gap between needs and response capacities have been particularly particularly serious. So this is an important issue to learn. And then finally, let me just say that even if it sounds to some as a broken record, international legal framework like international humanitarian law and human rights law remain key entry points on how, for best practices on how to deal with the pandemic. But I think it is important to keep a granular and differentiated view here again on what Nadia alluded to. Not everybody, not all the communities are affected in the same way. We have learned it from previous pandemics. If we don't know where the biggest vulnerabilities are, where the priorities are, we will basically have the wrong response this time again.
Thank you. That's very interesting. I think you really chimed with what Nadia Moured had to say to us about trusting these vulnerable communities. And that's the way that solutions properly adapted to them can be created. I'd like to turn to you, please, Ingrid Gabrielle Hoven, and your organization. What lessons did you learn from Ebola? And in what ways were you able to use them when it came to addressing COVID-19?
Thank you so much, Claire, and also many thanks to Nadia for this very inspiring introductory note. Lessons learned from Ebola, and I think we have perhaps now a déjà vu effect. Well, first, of course, during the Ebola crisis, we realized there where we had systems in place, and mainly well-functioning health systems that could really can serve people also in the last mile. Where you have those systems, even if a pandemic strikes a country, there is we are much quicker in order to reach people and to lower and to reduce the suffering. So preparedness, investment in systems that can actually provide a sound basis for quicker action when there is a need, because due to a crisis, and the crisis can be provoked by a pandemic, but as has been said previously, also the other risks are still at the horizon, like climate change, and we are confronting actually a situation in many developing countries where not only we have actually a suffering due to the coronavirus, but at the same time, because of droughts, because of floods, because of very extreme weather events that actually undermine the livelihoods of many poor and vulnerable people. So the first one, actually invest in preparedness, invest into preparation plans, create systems, shelters, etc., that can provide some kind of a cushion to those vulnerable peoples when the worst hits a community or country. But the second one, also to figure out whether we need specific tools that could actually address and focus on the very specific issues that are at stake. And after the Ebola crisis, on behalf of the German government, GIZ implemented a so-called epidemic preparedness team, which is actually a team that mainly sets an expert team that is composed by experts coming from German health specialized epidemiology institutes, and at the same time work with local communities. And when we get, for instance, a plea from Rwanda, from Colombia, that they need a specific expertise to strengthen the testing, to strengthen the knowledge and the capacity of health workers in specific areas, and perhaps to give a reassurance how big actually a pandemic has hit already the country, we can actually deploy these teams. After a couple of days, as soon as they are ready, they can actually get on a plane, bring material with them, and try to at least to build up a core of specialized people that can actually perhaps then work on specific cluster of the pandemic, and by doing so actually try to contain a bit the pandemic as such, or actually provide better knowledge to governments to take the right decisions. So these types, this is one lessons learned. We built up the system after Ebola, and unfortunately it served quite well during this was luckily it could serve during the pandemic, but of course nobody expected after Ebola that after a very short time we would actually face an even worse pandemic. The third point, and I want to like to pick up a point raised by Nadia as well. We have to take and implement differentiated responses. And very important is that we take gender issues very seriously. First, because women and children are in most cases hit worse by the crisis. But also because women take care of the families, of the elder people, of health issues, and this is quite key that actually we always take a gender-sensitive approach in all our implementation and pay a specific attention also to empower women during a crisis to take care of their families. And fourth and finally, and this also links back to a point raised by Mr. Maurer, what becomes quite obvious that many people were hit worse by the lockdowns due to the economic effects, because many people in developing countries work in the informal sector. They have to leave home to make a living. So when you have actually to stay at home, possibly this is not the safest place to be, because there's small places, etc. There's no water, no hygiene facilities. But additionally, the economic impact of the crisis, the impact on nutrition, on food availability, on consumption, on schooling, has been enormous. And this is an effect that may last even longer and will have a long-lasting and negative effect. So the point is, in those countries where we had more or less effective social safety nets in place, and when I speak about social safety nets, I start with school feeding programs and go to social security systems. But where those systems had been more or less in place and could be used actually to be scaled up and to reach poorer people, those that were now hit by the crisis, actually we could start to build up a cushion against the economic impact of the crisis and provide additional support so that people, families, vulnerable people can sustain their safety, their livelihoods. And this is a point that actually Nadia said, that in many refugee camps, many vulnerable peoples have no access at all to this type of public support. I think one lesson learned is that for the medium and longer term, governments and societies should invest more to build up the right, so to say, type of safety nets that could provide a higher level of resilience in the longer term. Thank you.
Thank you very much. Well, on the topic of refugees and displaced people, we heard Nadia said it, 26 million refugees in the world, 45 million displaced people. This question for you, David Miliband. What kind of information is your organization getting from the ground about the particular vulnerability of people living in camps and temporary accommodation around the world?
Thanks very much. The International Rescue Committee is focused on people whose lives are shattered by conflict and disaster. We work in about 200 field sites in 40 countries, so we've got quite a good sense of what's happening in war zones like northwest Syria, for internally displaced people, countries like Ethiopia, but also for refugees in places like Bangladesh. One really important point is that most refugees are not in camps, nor are most internally displaced people. In fact, 60% of refugees are in urban areas these days, not in camps. If you think about a country like Turkey, which took over 3.5 million refugees from Syria, 200,000 people are in camps, but the vast bulk are in urban areas. I think there are three messages that have come through very strongly so far. Some of them are surprising. First of all, COVID has been much less of a killer than we expected. We expected that because of the dense population in many of the places that we work, there would be very high risk that health systems would be overwhelmed. In fact, the youth of the population, perhaps, the fact that many people are outside, has actually provided a degree of protection. But the non-COVID health aspects, in other words, the impact on immunization programs, the impact on vaccination chains, the impact on malaria treatment, the non-COVID health impacts of the crisis have been greater than people anticipated, and obviously carry long-term damage for the way that they interrupt the service delivery. Our own organization has pivoted very strongly to sustain 100% of our health programs. We've learned from our experience of infection prevention and control in dealing with Ebola how to make sure our health programs could continue. And for the rest of our programs, education, livelihoods, child protection, we've been able to sustain about half of them in person and half of them have gone remote. The third aspect, though, of the consequence of the crisis is that the economic collateral damage, maybe the economic and social collateral damage, to pick up the speaker from GIZ, the social collateral damage on women especially, but the economic collateral damage has been much, much greater. Only a fraction of the amount that's been spent on sustaining industrialized economies has been spent on the poorest countries in the world, either in the form of direct aid or in the form of debt relief. On both those fronts, the international community has failed miserably, and even some of the aid that has been sent hasn't reached the front line. Only 15% of the UN appeal has reached frontline NGO providers, who are, of course, closest to the ground and can speak to the very important point that Peter MAURER made, which is that emergency response needs to be bottom-up, not top-down. It needs to be built on community trust and community engagement, and that's why at the International Rescue Committee, we spend some of our time training country emergency teams. You might be a finance officer, you might be an education officer, but you're trained so that you can respond to an emergency as it erupts. And in this crisis, the economic collateral damage has been, for too many, overwhelming. It's pushing people into famine. We know from the UN numbers that 70 to 100 million people are being pushed into famine. And in countries like Yemen, which is the world's largest humanitarian catastrophe, the combination of the economic collapse and continued warfare has really created the most disastrous of situations.
Thank you. Yes, well, collateral damage. Peter MAURER, I'd like to bring you in here. Your organisation, do you have any examples of the work that you're doing to try to limit the kinds of collateral damage that David Miliband was just talking to us about?
Well, I think by and large what David Miliband's organization, what ICRC is doing is at the core very much in traditional humanitarian assistance work already tuned to limit the damage. The question is whether we are able to somehow address specifically the sort of what Ingrid also has spoken about, the dropping out of the informal economy, and this creates a new type of victim, of beneficiaries, which needs new types of responses. What we have certainly seen is the necessity to beef up our urban programs, because COVID has affected urban populations in densely populated areas much more heavily. That's the paradigmatic places of which David and Ingrid were talking about at the end of the day, when we have secondary impact. We have urban situation where this is particularly important. I think whether it is health, water, livelihood, jobs, the situations have to be analyzed specifically on in each and every context, and in each and every context we have to design programs which are responding to those specific needs. But I would say that we have considerably beefed up our activities in urban settings, where exactly what David mentioned, we don't have necessarily a camp situation, but densely populated area in which informal income from informal economy has been critical. We have done a survey of beneficiaries in 23 countries of ICRC, and we have, as a return, almost 80% of the people have been reporting being heavily affected by COVID-19 and by loss of income, which beforehand was available. And here, of course, we encountered a big conundrum in which we are at the present moment, looking at an economic and financial and at least a payment crisis by many of the traditional donors of relief operations, which is now increasingly opening the gap between needs and our capacity to respond. But scaling and speeding our traditional places is what is at the core of what we are trying to do at the present moment.
Right. And Ingrid Gabriella Hoven, I'd like to bring you back in. You mentioned it earlier, gender, women, we were talking about collateral damage. Very often women are the most vulnerable. Could you expand on that, please?
Sure. Thank you, Claire. Well, of course, the impact of the crisis has been manifold. And first, of course, this was just mentioned by Peter Maurer, many economies in developing countries actually were under pressure, still are under pressure, loss of income. So the big question was whether governments and cities were in a position to sustain basic services. Among them, for instance, childcare program, vaccination programs, which are quite crucial for women and young children. So one point actually I think was quite crucial to see, and this was mainly done by multilateral development banks, whether we sustain a certain level of public services within countries, so that not due to a lack of income and a downturn in economic activities, actually those services are being cut back. Of course, there were some impacts, but I think this was one avenue to take, also to protect programs that benefit primarily women. The other point is, of course, that the women during the crisis, as most of them are more heavily working in the informal sector, that due to the lockdown they had no further income. So how can this be substituted? How can they make a living? How can they buy food? And the numbers on nutrition, the nutrition status, on the increase of people that actually face hunger, speak to themselves. And most of them are women and children. And therefore, I think one has to address those issues specifically and focus on programs that may benefit women specifically or children at an early stage, so that we don't have long-lasting effects. Women also have many times they have less savings, they have less access to economic assets, and due to the economic impact of the crisis, where we also saw that actually smaller enterprises in the formal sectors had difficulties to survive, where jobs were lost, where there are no social safety nets. And the big point is, how can you actually make sure that the women stay in the economy and get also after the crisis another chance to continue to be in the business? And we got some numbers that actually female business, especially in Africa, were much more affected by the crisis because they are less formal, they are smaller, they have less assets, and they have less access to the financial sector. And there again, I mean, the question is, can we provide additional liquidity, additional support, capacity building, so that they can maintain a certain robustness throughout the crisis, can reactivate the business after the crisis. So many effects, I think, we have seen over the last couple of years already that we still have a huge gender gap. And we have to do more in order to achieve gender equality. And therefore, all of us are looking forward to the big Gender Equality Forum next year in France, really to make a difference and to turn a little bit the awareness into an investment area that has been desperately underserved in the last couple of years. And I think this is going to pay off. But certainly, the COVID-19 pandemic has severely affected the position of women within their societies and their economies. One specific effect is really dramatic, I think. Many young girls have dropped out of school. Or even those cases that have been reported where young girls were actually were forced to get into a marriage earlier than expected. And they have no chance actually to have their own profession, stay in school and to decide about their own life. And these are effects that some you see them in an anecdote, but when you look into those numbers that have been reported by the UN system, you see this is almost systemically, because women have been one of the weakest elements within societies. Thank you.
Well, I'd like to bring you, David Miliband, into this. We're hearing young girls dropping out of school, marrying earlier than they had intended to, childcare, vaccination programs affected. How do we carry on going forward with all these challenges coming from COVID-19?
Well, I think that Ingrid has done a great job in explaining some of the blockages that are not just institutional in the communities where you're talking about, but also in the international system. I just want to point out that when it came to the first humanitarian appeal around COVID, the needs of women and girls, and especially the needs of women and girls who are survivors of gender-based violence, was all but ignored. It was a complete sideshow. And so it exposed the gap between rhetoric and reality in too much of the international system. Less than 0.2% of the global humanitarian budget is spent on the survivors of gender-based violence, and that's only the apex of the pyramid of inequality. In terms of turning it round, I think that my approach would be to highlight 3 or 4 key components. The first is that we need to start from an understanding of the structural inequalities of power as well as opportunity that hold women back and girls, both in the communities that we're talking about and in the international system. In some countries, and our organization talks about how you can't be a successful humanitarian organization unless you're a feminist organization. To me, that means taking seriously inequalities of power. And I'm proud to say that, and I don't flinch from it. Secondly, if you don't measure things, you don't manage them. And there's been some progress in the disaggregation of data on gender grounds, but when it comes to healthcare, when it comes to employment opportunity, when it comes to child protection, when it comes to education, when it comes to livelihoods and cash programs, we need to do a far better job at making sure that we are clear that it's an absolute basis of humanitarian or development action that you measure according to gender, but also that you set targets that recognize the special and extra inequalities faced by women and girls. I think the most important change we could make in getting the development and humanitarian systems to work together would be for them to have joint targets for which they're jointly accountable. That's the way to get leverage on the most basic issues. Are there locks on bathroom doors in refugee camps? Is there proper lighting? Are cash programs reaching women and girls, women and not just men? Third point, which is a real point of learning for us at the International Rescue Committee. We're now the largest impact evaluation agency in the humanitarian sector. We take very seriously the evidence. Here's the evidence about some of the social programs that are being talked about by Ingrid and Peter. The evidence shows that social service programs are many times more effective if they are allied to economic empowerment programs. If you divide a social program from its economic counterpart, you don't have the same impact as if you bring them together. And that's why we talk about women's protection and empowerment as the theme, not just tackling gender-based violence. You've got to address this on both the economic front as well as the social front. Final point that I think is important, the maxim for us is follow the evidence. The evidence shows that cash distribution schemes are the most effective way, not just of meeting humanitarian needs, but of empowering women. Follow the evidence, secondly, when it comes to child protection schemes and the way in which family intervention is important. Follow the evidence about education. We know, you I think hinted at this in your question, that the evidence from previous emergencies is that girls who are forced out of school as a result of an emergency are less likely to go back to school than boys unless extra action is taken. And we don't just have to do this according to heroism, we need to do this according to the evidence. And so I'm sure that's not a comprehensive answer, but I don't think we can take refuge in the idea that we don't know what to do. We do know what to do in many ways, but too many parts of the system are not matching words with action. And it's, I'm not just saying this because she's here, but Ingrid and the German government overall they do try to match rhetoric with reality, not just in GIZ, but also in other parts. Swedish government, very strong. French government, moving forward. Too many others, they support something called the call to action, but there isn't enough action.
Well, that does sound like an issue, a call to action without action. I would like to turn to you, Peter Maurer. David Miliband did mention the issue of gender-based violence being brought to light. What about mental health? Can you expand on the impact of this pandemic on mental health? Is there anything that you're hearing in your organization from the ground up?
I think mental health challenges in the context in which we are working are not something specific to the pandemic, but as in many other areas, the pandemic has been an enormous accelerator and accentuator of problems that we have seen emerging over the last couple of years, much more powerful. Not that they haven't existed before, but I think it was important that finally we started to get our head around that this is a phenomenon which is hidden very often in society, which needed to come to programming, which needed to be recognized in our work. And what we see, of course, is that whenever a society and communities are under stress, whether this stress is pandemic-related, violence-related, natural disaster-related, the consequence is always increase in mental health challenges in an area where most of the time the response capacities are minimal. At the ICRC over the last 3 years, this was the fastest growing program that we had, the mental health and psychosocial support program, because we strongly believe that the situations of fragility which were compounded by COVID-19 need a specific focus on mental health program. And so with the emergence of the pandemic, we tried to figure out what some of the specificities are which are related to the pandemic in order to adapt our more than 170 programs and projects that we are running worldwide in the 35 most violent contexts. But it is the combination, again, of violence, of war, of being caught in between warring fractions, of outrageous disregard for international humanitarian law, outrageous disregard of safe humanitarian spaces, which basically lead us with an enormous pressure on the mental health situation of an increasing large number of people in the context in which we operate. And this is a very serious concern. I just want to go, whether it is mental health or any other programming, just really to emphasize what David has mentioned before. It's not only true for women and gender-based issues that empowerment goes with the programming, and cash is the most efficient way to do it. It's the same in any other issue that we pick and which emerges in community as being one of particularly fragility and pressure to community. That's the way to go, and that's the biggest impact we can achieve.
Thank you. So empowerment is the word. I've got to ask you, Ingrid Gabriella Hoven, is there any reason that we could be a little bit optimistic in terms of the lessons we've learned from this pandemic? Of course, we're still in the middle of it, but is there a little reason that we could perhaps feel a bit positive from time to time moving forward?
Well, certainly, one has to say that still, I mean, our societies, the worries, our economies, we are still, our political systems, we are, I think, still very much absorbed by the pandemic. And of course, the first good news about a possible vaccination is perhaps then light at the end of the tunnel. So one has to recognize this, and it's understandable that of course governments, institutions, international organizations want to give their best. to react sufficiently bold to the crisis. But I think that this time, what I see internationally in the discussions in the fora that we are participating in as implementing agency, is certainly that one gets a higher level of awareness that actually we have to invest much more into the resilience of societies and to look a little bit deeper. What does it take? Where do we have this specific evidence that David was alluding to, that we should actually take as to inform the international system, the multilateral system, the development cooperation system, humanitarian system. And certainly what I see is that actually this debate also has shed some light on the other types of risks that are still out there and that don't go away. And Peter Maurer mentioned them at the very beginning. Of course, right now the political system is absorbed by COVID-19. But we all know very well that if we don't contain global warming, we may actually face risks that are going to be even more difficult to manage. So hopefully that this is one lesson learned, that it makes really sense to take the evidence that is out there from science, and that we consciously actually also factor in the right activities, the right political decisions in our response to COVID-19, in our recovery plans, in our plans actually to have vulnerable people. So that we can actually create win-win situation when a dollar is spent that's not only focused towards an immediate response to COVID-19, but also has the structural, long-lasting effects, build up systems, build up capacities, and resilience of specific people. And I think that this is really a growing common understanding that this is necessary and has to be hopefully implemented forcefully. Secondly, I think that the crisis has had a positive impact on the consciousness of many actors that we need more joint cross-country multilateral action. That we need strong multilateral institutions, and we need strong partners really to face a crisis. The crisis can't be contained within one country, but we really need cooperation. So I think that this consciousness is growing, hopefully across the globe, that more cooperation is needed. And if we get the right systems in place, at the national level, at the international level, and if we work and cooperate across the aisles between the development system, with the humanitarian system, between different levels of our international system, that then we really can have a big impact and can turn things around. But if we simply don't cooperate, we go back to nationalism, then certainly this is going to erode a system that is needed in order to face bigger crisis that may hit us due to other events. And there again,
so we're interconnected.
A light at the end of the tunnel. Sorry?
I was saying, so we're interconnected,
Thank you,
so we need
This is
cooperation.
my last point. Thank you.
No, that's excellent. That leads me perfectly on to actually my final question, which I would like to ask all of you. I'm slightly putting you on the spot. David Miliband, I'm going to start with you. Can you give me any examples of extraordinary solidarity that you have seen within your organization within the context of COVID-19? An example of people really coming together, extraordinary solidarity. Could you give me any examples of that? And I'll go through afterwards and ask the other panelists the same question.
Well, I can give you dozens of examples. I've just come out of a meeting of our leadership team. One of the things we're talking about is duty of care and how colleagues are supporting each other. And so our Women at Work groups are working on Zoom to support each other around the world. That's one example. Secondly, I'm really excited by the fact that we've worked with a local community group in Bangladesh to produce 500,000 masks for use in the refugee community. That would be a second example of solidarity. Thirdly, I'm really very, very struck at how around the world, despite borders closing, there has been a real embrace of those who've been forced across borders. We often bemoan and deplore the rhetoric about the dehumanization of refugees. In almost every country that we work in, I've seen extraordinary efforts for people to work together, recognizing that this is a disease of the connected world, and unless we address it together at every point, we're not going to beat it. So those are just a couple of examples, but I'd be very happy to give you more.
Oh, give me more. We have time. We have time. Please give me more. It's lovely to hear such positivity. It's lovely to hear people coming together.
I think that the way in which our education programs have pivoted to help ensure that there is a mitigation of the danger that children's education is interrupted has been really remarkable, and it's been our staff having to do things in completely different ways, because obviously education is based on bringing children together. That becomes much more difficult. I think that's been encouraging. I suppose one other thing that I would pass on is our first concern when the crisis struck, and we started planning for this in January, our first concern when the crisis struck was obviously, would we lose 30% of our staff to illness? And I'm very proud that although, of course, some members of staff have caught the disease, we've managed to turn our experience of infection prevention and control into a resource for our staff members. And perhaps the greatest pride comes from the fact that in Mali, I think I was told, but also in other places, other NGOs have wanted to use our guidance about how to protect staff in the way that they do their work. We try to work open book with the rest of the humanitarian system, and we're always very, very happy when other people want to follow the good practice that we start.
Excellent. Can I turn that question to you, please, Peter MAURER? Any examples that you can give us of extraordinary solidarity that you've seen within your organization?
I think the biggest achievement that comes to mind is really that everybody stayed and tried to do its best on the position they were. It was quite extraordinary to see all the internationals in so many contexts leaving and having our Red Cross workers staying, so that we only had to repatriate 3 or 4% of our staff, while everybody else, as difficult in a position as they were, stayed and continued to deliver services to people. And I think that was an enormous achievement that has allowed us to have an extraordinary implementation rate of our programs, despite all the obstacles and all the disruptions that we have seen because of COVID. Still more than 85% of our programs have been implemented according to plan, and this is quite extraordinary, and is really the commitment offered to frontline operators, which is, I think, quite extraordinary. If I look similar to David, to an example in our programming and engagement, which I found quite extraordinary, is that I think for the first time in the history of this organization, we have seen prison directors coming to us and inviting us to come to prison and help them. And I think it's quite extraordinary that while normally we have to fight for it, pandemics has sharpened the sort of solidarity and consciousness in communities that this was serious, it needed to be addressed, and some of the most vulnerable people were held in detention with the danger that COVID could somehow from intramuros, from within detention, flip into the community. And I think when I see the massive expansion of our health, water, sanitation programs, family reunification and family contact program by virtual tools and means that we have been able to develop in Africa, in Latin America, in the Middle East, and in Asia, it is quite extraordinary to see that it needed COVID to finally make so many prison directors and ministers of justice understand that we were all together in this, and we needed some basic humanity come to some of the worst places The fact that my colleagues did everything to make this happen, this massive expansion of work in detention, is maybe another important point I wanted to mention.
That's fascinating that you were given that access to prison directors and justice ministers, because I suppose there was this realization that we're all on the same boat and that we're going to have to cooperate a little bit if we're going to move forward in the right direction. The question to you now,
yes,
Gabriella Hoven.
Fear is an accelerator of positive things, and certainly fear from pandemic moving into the communities from prison has been an accelerator of this solidarity.
Well, that's a very, very interesting lesson learned on the COVID-19 situation that we're in right now. Just to turn the question to you, Ms. Hoven, solidarity, could you give me any examples that you've seen within your organization?
Yeah, very briefly, you know that GIZ is an organization that is working in many, many countries. We have more than 20,000 staff members. Most of them actually are posted in developing countries. And we have maintained a high level of presence throughout the crisis. And this has actually put us in a position to in the programs to build up trust, and our partners, governments, NGOs, other organizations, we are so thankful that actually, even if it was a little bit more reduced than normally, that they could continue to work on those development purposes and targets. And I think this is something that's going to last. This solidarity, the trust that has been built up, and this joint feeling that they're sitting in one boat, but that we can actually continue to achieve development goals when we work together, even if we are in a very severe situation. So this is something very positive that has motivated many staff members. Second point, even throughout the crisis, it was feasible to continue to work in conflict countries. We have recently decided to open up a country office in Lebanon because we are going to increase and scale up development cooperation in the specific countries. We all know what a severe year this was for many people in the Lebanon. And again, there I see actually a possibility to build up activities, and this should hopefully send a signal of hope and support to the country and those communities affected. And finally, I think that even throughout the crisis, one specific program, for instance, may not be been so much on the radar screen, but our staff members working on climate issues, they continue to provide advice to many environment ministries. They were actually in the course of revising their national determined contributions for the climate goals. And as far as possible, the partners wanted to maintain those processes and continue to work on those ambitious new targets. And these are signs of hope that even throughout the crisis, the longer term issues aren't be forgotten. And we have a very high intrinsic motivation in many governments and ministries. And to serve those goals and those ambitious targets by our partner institutions has been a high motivation for all our staff members. Thank you.
That's fantastic. That's nice to end a panel on a positive note. Thank you so much, all of you, for being here. It's a really interesting discussion. Thank you, of course, to our viewers for tuning in. You can, of course, watch this panel again, if there's any of it that you missed, on the replay section of the Paris Peace Forum platform. Thank you again for being here, and take care, everyone.
Thanks a lot.
Thank you. Bye-bye.
Bye.